What should one do if a family member is having behavioral problems?
So this goes back to um, really what's a differential diagnosis, and this is a medical problem. So in many cases, a behavioral problem is related to an underlying problem with their medical condition. So pain is one of those issues that can cause behavioral problems. Poor sleeping, urinary tract infections, any type of infection or underlying medical condition can cause behavioral problems. So that's the first item I'd like to discuss. Second is as patients get older, if they develop dementia, dementia can cause behavioral problems. So people with Alzheimer's or Parkinson's can have behavioral problems, not only from their underlying medical disease, but also from the medicines that we use to treat that. So the third a point I'd like to bring out is that many medications can cause behavioral problems. So medicines that are appropriate for younger people may not be appropriate for older people. Pain medications, muscle relaxants, even medicines over the counter can cause behavioral problems. Melatonin in particular, which is used for sleep, which is over the counter, can cause hallucinations. Benadryl, which is over the counter for allergies or what people use for sleep, can cause problems urinating and also behavioral problems. So it's actually very, very important to understand what medicines the patient is taking, what doses they're taking. They may be on the right medications, but they may be taking too many medicines at one time, or they may be taking over-the-counter medications. So it's very appropriate to understand their medications, to have someone supervise the medications, and to understand what medicines they're taking over the counter. And on the flip side of that, to understand their disease process. So their disease process can also cause behavioral problems.